Hi everyone, welcome to the SingHealth Nursing Virtual Open House. A little introduction. I'm Ethan, a year 3 nursing student at NYP and a member of the SingHealth Nursing Student Council, and I'm super excited to be hosting you today. And whether you are here because you are curious about nursing, already thinking about joining the healthcare family, or just exploring your options, well, you're in the right place. So, for today, we are diving into what it's really like to be in SingHealth as a nurse, and we're going to keep it real, sharing stories, opportunities, and what makes SingHealth an amazing place to grow, learn, and thrive as a nurse. We've got inspiring speakers lined up to share their experiences and a peek into our career pathway. And of course, try to ask all your burning questions. So feel free to drop your thoughts or question in the chat anytime, as we want this to be as interactive as possible. But before we begin, we are honored to have Professor Tracy, the Group Chief Nurse of SingHealth, with us here today to start off today's virtual nursing open house. So without further ado, please welcome me in welcoming Dr. Tracy. Over to you, Dr. Tracy.
Thanks, Ethan. Hi, everyone. It's so nice to see all of you. Thank you for joining us as whether you're a potential SingHealth nurse or potential nurse in the future. So I'm given 2 minutes, so I'll be very brief. I'll just give you some aspects of who we are and what do our nurses do. And you please feel free to stay on for the rest of the 2 hours to hear from our nurses about their real life working stories. So welcome again. Next slide, please. So who we are the largest public healthcare cluster in Singapore. Every year we have over 4 million patients, and hence there are many clinical specialties. As of now, we have over 42 of them. And so you have diverse areas that you can work in, as well as find your niche in terms of specialization. We are the largest nursing employer in Singapore. We have over 13,000 nurses. But most importantly is that we are committed not only to our patients in the institutions, but also our residents in our communities, spanning the whole gamut of care from preventive, chronic disease management, wellness promotion, acute care, rehabilitation, community, palliative, as well as end of life. We have achieved world ranking status of being among the best in the world. You would have seen papers or Facebook postings of where we are. For example, our flagship hospital, Singapore General, had attained 11 in the world out of top 250 hospitals worldwide. And we rank among the best in the United States as well. Many of our other hospitals have also ranked highly, whether they are as a smart hospital or has a specialization that they are famous for. Next, please. I would say as you listen to the rest of the nurses speak today, you will realize that we are the future. SingHealth nurses have been shaping the future of healthcare all these years. Our nurses take on expanded roles with the shift in care models. They likewise have also taken on new roles as well as new capabilities in order to provide care for our patients. They have been equipping themselves with future-ready competencies, so not only in nursing care, but out of nursing realm as well, in terms of innovation, data analytics, process re-engineering, things that you would have already learned in school or heard of while you were in school. We are using technology to augment our nursing work. So there are robots, artificial intelligence, smart devices, wearables that are in place to help us do better. We are actively working with nursing schools to develop practice-ready nurses. So whichever school that you eventually join has to become a nurse, we can all contribute to the agenda of building tomorrow's healthcare. We are committed to fostering healthy and supportive work environments that you can thrive in. Not only in Singapore, but we are also making an impact globally, especially around the countries in Asia, where we help to build the capability of the nurses in these countries. And of course, everyone's mind, future generations' mind is on these few things, right? Sustainability, diversity, inclusivity, equity of care. And so in that way, we are also contributing to the international agenda. Next, please. You will hear our nurses speak later about the various careers that they are involved in, but I just give you a summary. We do have 6 different career paths, the most career paths among all the institutions in Singapore. We run from research, education, management, informatics, innovation, as well as clinical. I have indicated here that you can read for yourselves for what each path represents. So as you join, and if you join as a nurse in Singapore or in SingHealth, or you decide to join us after your nursing education, you can be assured that you will be able to build your career in whichever path that you choose. Each path comes with its specific training roadmaps as well as the competencies that you will need to build, but we are committed to advancing you. In the clinical floor, that is our bread and butter because we provide care for our patients. In that clinical track, you can also become advanced practice nurses if you wish, and that is really at the top of the license that they are practicing. Next, please. So thank you, and I'm very happy to have all of you here at this virtual open house, and please continue to engage with us even after this session if you have any questions or any comments. Thank you.
Thank you so much, Dr. Tracy, for those inspiring and thoughtful words. It's always very motivating to hear about the passion and vision behind nursing in SingHealth and how the healthcare have grown in terms of technology, in terms of nursing manpower, and shaping the future together in healthcare. Your insights truly set the tone for today's session, and I'm sure everyone feels inspired, and as I do, about the incredible opportunities in nursing. Now, without further ado, let's dive into the rest of our program. To kick things off, we are starting with No Cap Just Care, a SingHealth nursing journey sharing session by Sister Fong Ling Ling, nurse manager of SingHealth Polyclinic, and Sister Ng Swan Gate, advanced practice nurse in neurosurgery at the National Neuroscience Institute, on the different career pathways in SingHealth nursing has to offer, and their nursing journeys. So sit back, relax, maybe grab a bubble tea, and let's get started. Sister Fu, Sister Ng, over to you.
Hello, everyone. Thank you for joining us today. I'll be sharing my slides now. So I'm Ling Ling here, and I'm thrilled to share my unique nursing career journey with all of you. From being a registered nurse to what I'm currently am, a nurse manager in a SingHealth Polyclinic. Before I begin, I'll be showing a slides that has been shown by Prof. Tracy, which is the career development in SingHealth institution. So from all the different branches, you will notice that there's a vast area nurses can actually grow and develop our very own specialization. I hope this actually gives you a bigger picture on what SingHealth can offer in terms of career development for nurses. So what has been reflected here, the 6 branches will be the research, education, management, clinical, informatics, and innovation. So as for myself, I'm actually in the management path, and I'm currently assuming the role of a nurse manager. And now, let me share with you a little bit about my nursing journey. I'm actually born in Malaysia and completed my diploma in nursing in Malaysia. Then I took a leap of faith by being the one and only from my batch to actually start my nursing journey in Singapore. From there, I will describe my nursing career journey as a nomad traveling around the world of nursing in Singapore. So, my very first home was actually a private institution, and not many of you will be able to identify which institution this is because recently they have changed their uniform. I was there for about 8 years, in which I've gained and honed my basic nursing skills in a medical and surgical ward. I was then promoted to a senior staff nurse and subsequently to a nurse clinician in the same institution. After stabilizing my role as a nurse clinician, which is in this second picture, who is in charge of providing care for patients and managing a ward, I then become curious, how does a Singapore healthcare public sector actually works and how do they actually provide care for the population of Singapore? And I asked myself at that point of time, am I willing to step into the unknown world of public healthcare? Well, being young and curious, I took the opportunity and joined my second home, which is Singapore General Hospital, where I assumed the role of a nurse clinician in a medical ward. It was an eye-opening experience, and I was given lots of opportunity to learn and grow with the institution. I was able to deliver and experience the care needs of different populations from what I've previously encountered. As I progressed in my career, I shifted from clinical practice to nursing education, embracing the opportunity to shape the future of nursing by assuming the role of a nursing lecturer in my third home, which is Nanyang Polytechnic. This role has given me an opportunity to share my knowledge, skills, and experience with nursing students, in which now most of them have become part of nursing workforce in SingHealth. And lastly, in 2019, COVID hits. With the increased needs of nursing manpower in clinical area, I decided to move to my next home, which is my current home, SingHealth Polyclinic, as a nurse manager. This role has given me another perspective of nursing in which we manage the ever-changing workflow and process that comes with the updates from MOH in managing the COVID-19 situation. As a nurse manager, we ensure the delivery of high-quality patient care, managing welfare and continuous education of our nurses, and oversee the clinic operations to ensure everything runs smoothly during the pandemic. My nomadic journey through nursing profession has been transformative, and I hope by sharing my experience, I've inspired you to explore the boundless possibility within this noble profession with SingHealth. With this, I end my sharing. Thank you.
Thank you, Sister Fu, for sharing. And do you know that there's a role that's between a nursing and a doctor? Not only they are nurses by training, but they are also doctors. They are also trained to hold some aspect of a doctor's role. They are also known as advanced practice nurse, aka APNs. So for this, I'll let Sister Ng, to share more on her journey. Sister Ng.
Yeah, can you? Yeah. Hi, thank you, Sister Fu, thank you, Ethan. Yeah, my name is Wange. I'm an advanced practice nurse from National Neuroscience Institute. Okay. So like Sister Fu, I'll be sharing with all of you my nursing journey and what has motivated me all these years and being resilient and embrace the changes throughout my journey in both NHG and SingHealth Institute. So I started my nursing journey in 2000 as a registered nurse where I joined NHG first. Um, at that point of time, I'm a general ward nurse. During the years, I did my bachelor and I did my specialty advanced diploma in neuroscience. And subsequently, I had my experience in uh, neuro ICU. And because of all these years of clinical experiences that I have, I decided to join National Neuroscience Institute as a specialty nurse to explore more specialized nurse care to help with the patient. After a few years of joining National Neuroscience Institute as a specialty nurse, I I wanted to share my knowledge and try to explore new areas. And I tried join Parkway College as a lecturer, where I have spent a few years with them. Subsequently, I find that my interest is really clinical nursing because I love to talk to patients. So I joined back NNI in 2013, where the clinicians and nurses have encouraged me to embrace my journey further being an advanced practice nurse. And they have offered me this role to join Masters of Nursing in NUS in 2014. I have joined them. And I had my years in 2014 to 2016 intern and subsequently passed out as an advanced practice nurse in 2017. So what is my current role? So being an advanced practice nurse, I did clinical education as well as global health. As a clinical advanced practice nurse, I work with the team doctors to see patients in the ward. We assess patients, we review patients' clinical conditions, and we share with the doctors on how to treat the patients and what are the treatment options available for the patient. In the clinic education track as the advanced practice nurse lead, I actually oversee our advanced practice nurses in our institutions on their journey towards advanced practice nurses, as well as the clinical nurses in their education journey track. Another CCA that I'm doing currently is global health. So in global health nursing, we aim to share knowledge with different countries, as well as we aim to increase the capability of the nurses in the countries as well. We have worked with nurses from China, Indonesia, as well as Hong Kong, and also from nurses with nurses with Sri Lanka. So this is a picture showing that we went over to Sri Lanka for bedside and classroom teaching. So what is APN development? With aging population, we recognize that it is important to develop our nurses in clinical track to assist in promoting health and reducing illness, and Ministry has formed a development committee to focus on how we can develop a team of reliable and dependable and clinically grounded nurses. Practicing at an advanced level research has also demonstrated that APN intervention had decreased the length of stay, readmission rate, lower healthcare costs, and improved patients and family satisfaction. So this is strategy of APN development. In order to build a ready workforce, our strategy is to identify potential nurses early in their career who aspire to become advanced practice nurse. We mentor this group of nurses by providing them with skills and knowledge, review their readiness before they embark on Masters of Nursing. Now we have 186 APN by end of 2040, which is last year. So our training has anchored competent APNs in the various areas like oncology nursing, cardiology nursing, critical care nursing, mental health, pediatric, geriatric, primary care, palliative care, community health, and emergency. So SingHealth has launched a Center of Global Nursing last year. For our APNs have also taken the role to provide training and development for the developing countries. So these are our APNs leaders that have over the years won the President Award, which is which they have led their team effectively, bring their service to the new heights. So with that, I thank you. Hopefully my sharing can help you to inspire to be nurses with SingHealth. Thank you.
Wow, thank you so much for sharing your amazing stories and unique journey. And I'm pretty sure everyone has burning questions to ask for both of you. So to the audience, now is the time to ask away. Let's start with the first question. And if you want to type your questions, please type them down below. So the first question for me, it's mainly for my question because I'm a student nurse. I want to know that what's the average years of experience to promote to become a ward sister for sisterhood?
So basically, it's based on the staff performance. Average, it takes about 8 to 10 years.
Oh, 8 to 10 years.
Yes.
So does it include like what kind of education does it include? Can I be a sister at a degree level?
Yes, you can be an assistant with a degree level. However, it will be good if you actually obtain your advanced diploma as well. So basically, it also shows that you have found your specialization that you would like to major in. Yeah.
Okay. Thank you so much. And how about for Sister Ng? How long does it take to be an APN usually?
to gain 18 degrees.
Also, it's around 5 year experience and a degree in advanced diploma. That's very interesting. So, in a sense that if I starting from a diploma level, you take around on average of 5 to around 8 to 10 years in a sense. Yeah. Okay. Then, in a sense, so having so much commitment, right? I think for the both of you, how do you manage your duties with like personal life, going out to re rest and relax? Maybe Sister Fu can start first.
Okay, so basically, as nurses, you realize that after we have passed out and we actually work in the ward, time management is one of the core skills that all nurses actually have because all of us has a lot of tasks to actually complete within our shift. And therefore, when you actually ask me whether do we have time for ourselves, yes, definitely we have. If you're working during shift hours, you can actually, after work, you can plan your own personal activities that you like. And in terms of, you can also spend some time with your colleagues, whereby in my workplace, we do have out of polyclinics working hours, my nurses actually do go out together. They enjoy interests and hobbies that's together. Yeah, so at the same time, they actually did some team bonding and it helps them to relax and to actually take their mind off from the stress at work as well. Yeah, thank you.
How about Sister Ng?
Just to work with study start with most of on top of that, because the pressure whatever we don't mind spending time with our work as well because of the ever changing health different CCA that we have that actually touches our own interest. We tend to move on, even sometimes at our free time we are willingly doing work at the same time. But of course, balancing between family and work is very important. Therefore, most of the time, we, I will spend more hours at work, but of course, during the free time, I will balance out with the family.
I think there's a lot of sacrifices. I think as a student nurse, I find myself like struggling within the balance of life and work already. Yeah, so can imagine myself in 10 years to come. Yeah. Okay. Then in that case, what are the challenges you guys face in as a nursing manager and as like a advanced practice nurse? Maybe we can start with Sister Ng.
As an advanced practitioner, I must say that for the degree, a lot of doctors is very blurred with the role as advanced. They actually always have nurses in the ward. So they didn't know that they do more than what we can. So as an advanced practitioner, apart from having masters, being able to assess patients, being able to interpret results, offer treatment options, we also do have an opportunity and it's one of our pathways to develop to have a business right. This is the first step. We are able to run because of standard role that we have. So most of the time we have to reallocate the patients every time we can have to orientate them, tell them about the key role and the ability that we have in order to work with them. So these are the challenges that we met initially, but as years go by, we have more APN doctors, different specialty doctors, so came to know more about us. Currently, it's more easier to work with them.
Okay. How about for Sister Fu?
For myself, as a manager in a polyclinic, I think managing the patients and nurses' expectations will be a challenge for me because patients actually have very different expectation due to their own perspective on life, and it's the same for nurses as well. So as a nurse manager, like what I've mentioned previously, we need to manage our patients' expectation. Example for in a polyclinics, what is our patients' expectation when they actually comes in? Into a polyclinic, basically what they want is safe care and also to ensure a smooth journey ahead lah, without a very long waiting time as well. So for nurses, it's also very personalized. We need to understand our staff much more better, as we are the one that actually caters to their needs and actually groom them to the next level of profession as well. So I think this is one of the few challenges that I would face as a nurse manager. Thank you.
Thank you so much. Uh, for Sister Ang, I think there's a question for you. Could you possibly give a bit more explanation on the difference between an RN and an APN?
Okay, a registered nurse is uh, we have a diploma, and along the years we can have degree or specialty tech nurse. Right? However, the difference between advanced practitioners who are also registered nurse, we also go through specialty degree like any other registered nurse. It's just that we had this expanded role that we have special training where we went for Masters of Nursing, that we learn more about patient assessment, identification of patients during assessment, what is the differential diagnosis to patient complaints. We learn how to take the history from patients from their complaints when they come to see doctor, and we are able to identify, give a differential diagnosis, offer treatment options in collaboration and discussions with the team doctors, as well as we have further training of prescriptions, right, which registered nurse cannot prescribe medication, but advanced practitioners do able to prescribe medication. And there are certain collaborations with the team doctors, like investigations that we can order, drugs we can order, and we are able to interpret results as well.
So it's more of like the difference between an RN and an APN is more of taking more a role of a doctor role in prescribing medicine, looking at investigation, interpreting investigation results, in terms of getting more training by the years as a nurse and going
Right.
to specialization track.
Yeah.
Thank you so much. And then what is, for both of you guys, what is the most memorable incident that you are able to share with us? Maybe we can start with Sister Fu.
For myself would be the most memorable one would be, I have two actually, but I'll just focus on my staff. So basically, I do have a staff that actually was encountering a lot of personal issues that actually affected her work life, in terms whereby high absenteeism rate, and she's unable to cope with work as well. So as a team in polyclinics, we actually work together. We actually had sit down for the manager's side and also the staff to actually work around her issues and see how can we better support her. And throughout her whole journey, I think she was very thankful that the polyclinics, the management, and even the whole institution actually stand by her throughout her difficult time, and she managed to get over it. And now she has become one of our most competent senior staff nurse in our polyclinic that is performing very well. Yeah, that's for myself. Thank you.
Thank you so much. How about for Sister Ng?
For myself, actually I have quite a few, because along the years, I did quite a few checks. Personally, I'm a head injury nurse for trauma nurse as well, while I'm in my specialty, so in advanced practice nurse. So during my transition between specialty nurse and doing I have actually had a patient with a severe head injury, where I see a recovery journey, and I manage the patient together with the team, and subsequently see him recover from inpatient to my clinic, and now able to do well in the community. Which this is something which is very fulfilling as an advanced practitioner, because I manage him while he's inpatient. I see him in my clinic while he's an outpatient patient. So this journey is very, very important to me, because it's something that as a ward nurse, as a junior nurse, I don't see them journey out into the community. I don't see that recovery from them. it's always either I see them off from ICU because I have an illness, or I see them off as a staff nurse in a ward where they go weekends. But as an advanced practice nurse, this role has allowed me to see their journey throughout, which I see is a very fulfilling, and
Oh,
this keeps my passion.
thank you so much. So it's more of, as a nursing manager, it's more of creating like a supportive environment for your staff. And as an advanced practice nurse, it's more of seeing a holistic care, seeing a patient come in, as what Sister say, having a traumatic brain injury, into nursing and healing him back to the community and seeing him very well in clinics, and overall having a very speedy recovery. Yeah, thank you so much for both of you. So right now, let's take a trip back from being alive as a as a nurse, and let's hit back as a nursing student instead, where we invite Rajesh, a staff nurse from a National Heart Centre Singapore, who just completed his degree at King's College London, and Sumana, a student who currently is studying at the Singapore Institute of Technology, and they'll be sharing with you their experiences from these schools. And also, fun fact, they are also part of the SingHealth Nursing Student Council. Raj and Sumana, over to you.
Hi everyone. Are we audible? Can we hear? Can you hear? Okay, yeah.
Okay. So, hello everyone. My name is Sumana. I'm currently a fourth year nursing student studying in Singapore Institute of Technology.
And I'm Raj. I'm actually currently working as a staff nurse at the National Heart Centre Singapore. I just graduated from King's College London like a few months ago. Yeah. So in this sharing, we'll just be taking you all through our journey with SingHealth ever since we were in year one of poly until now. So just sit back and relax and enjoy our sharing. Okay, let me just get to the next slide. Okay, so maybe I'll just start off with my journey first. So I graduated from NYP in 2023. So I've been bonded to Heart Center ever since my first year of poly. And as you can see throughout my poly life, I had many opportunities to intern in various SingHealth institutions. For example, I went to KKH for my pediatric posting, and then my medical surgical posting was at SGH, and eventually my PRCP was at Heart Center. And it was great that I got to have some form of touch point with SingHealth throughout my poly life. Of course, it was also with other clusters as well, but one thing I really took away from SingHealth was just that community that I could build, because at the end of the day, I mean, we all want to improve patient care, and at SingHealth, I think that was the key focus, and it was emphasized throughout all our clinical postings, and that is something I took away from my poly life as well. So after graduating from NYP, I went to King's, but I'll share about that in a short while, but I'll hand over to Sumana to share about her poly life as well.
Okay, so similar to Rajesh, I actually graduated from Ngee Polytechnic in 2023. So as you can see from my photos here, I also went to various SingHealth institutions such as SingHealth Polyclinics, KKH for my gynae posting, and subsequently National Heart Centre for my final year posting as well. So also, similar to Rajesh, I was also bonded to National Heart Centre since I was in year 2 under the MOHH Healthcare Merit Award Scholarship. And then, if you can see on the top left-hand corner, maybe you can identify some familiar faces. Actually, I'm standing next to Sister Fu. So, one of the many perks of being a SingHealth nursing student is that I get to interact with my SingHealth managements, and then also get to touch base with all my National Heart Centre sisters and educators. Okay. Okay, so we are also part of as Ethan mentioned, we are also part of the SingHealth Nursing Students Council. So as you can see from the many photos that we have here, we had many opportunities with working with our SingHealth management. So I'm actually the chairperson of the Students Council.
And I'm the current mentor, one of the mentors of the Students' Council as well. So actually now, as part of the Student Council, our main focus is to engage with our nursing students and be like a voice for our students to relay their concerns and needs to the management and see how we can find solutions to improve and enrich our nursing student life. And that's what we've been doing for the past. We are in the third
Batch.
iteration of the SingHealth Nursing Students Council. And yeah, so it has been a really great journey, I would say, meeting different students from different walks of life, different educational backgrounds,
Mm.
and we even try to see what are the concerns for our international students in our respective institutions and see how we can support them in the best way possible. Yeah. Yeah, so moving on to my journey. So after graduating in 2023 from NYP, I got to go to King's under the Integrating Nursing Scholarship by MOHH. So it was a very short program. It was a short honors program of about 10 months. But even though it was a short program, I had a chance to meet a lot of new people and learned a lot of life skills on top of all the nursing skills that I gained throughout my experience. And being a student representative of my program, it also was a chance for me to engage my classmates and see what are the best ways we can support each other and improve our student life as well. So I was in the UK for about 10 months, and yeah, it was very different. It was a very unique experience, I would say. So one of the key takeaways from my experience was forging new friendships. So as you can see, a lot of them are international students. So some of them here in the pictures are nurses, and some of them are from other courses as well. But I think one thing that unified us was our, like at least for within the nursing community, was the fact that we all wanted to find ways to improve patient care. And hearing stories from different students from different countries and their different healthcare systems was also very insightful to see where we stand in Singapore and what are some of the things we can learn from other countries as well, and how other countries can learn from our healthcare system as well. So I think the friendships was something that really was a key, something memorable in my entire experience, I would say. And then, of course, being a nursing student, it was a great opportunity for me to meet luminaries and nursing leaders from all across the world. So, for example, at King's, we have a lot of engagement sessions and seminars and dialogues with nursing leaders throughout the program. And these are just some of the important figures I got to meet and engage with throughout my time at King's. So one of them is Dr. Linda. She's actually a professor of nursing at UPenn, and also Dr. Bibb. She's the president of the Sigma Nursing Association. So these are just two of the examples of people I met throughout my experience, throughout my King's experience. Then, of course, Prof. Ian, who's actually the chief editor of the British Journal of Nursing. So because my program was more research driven, so it was a great opportunity for me to meet research nurses as well. And these are some of the important figures within the research community. And Dr. Helen, who's actually a principal lecturer at Oxford Brookes University. And I think one of the things that I took away from meeting these people was how humble they were. I mean, for the number of years of experience and expertise that they have, the fact that they were willing to share their experience with me and just share some insights to inspire me to kind of pursue this track was something I really took away, and I thought was really great for them at their level, right? Then, of course, yeah, Prof. Julie, who's actually the president-elect of the ACNAB Association, and of course, nursing researchers from from across the globe. Yeah, I think that was something that really allowed me to find out more about how they thrived in the research sector and what are some of the lessons or takeaways they could share with me in terms of building my career moving forward in nursing research. Then, of course, being integrated nursing scholar under MOHH, I was also able to tap on funds to support my developmental opportunities as well. So, for example, I got to be part of the Association of Cardiovascular Nursing and Allied Professions Congress in Poland. So it was a 3-day congress that I was a part of. And of course, being in a heart center, it was really something that was relevant to my discipline and the institution that I'm bonded to. So I got to hear from different researchers from all across the globe on all their findings and research efforts in this field of cardiovascular nursing. And likewise, I got to attend the 7th Biennial European Conference in Bournemouth, or in the UK itself. And there was also another opportunity for me to meet nursing researchers from different walks of life and different age groups and from different countries. So I think the biggest benefit was really the networking and being able to learn a thing or two from them in terms of identifying what are some of my areas of interest that I can then relate with them and get some, feedback or some insights on how I can then, chart my path in nursing research. Then, of course, 2 other conferences that were in UK itself by Imperial and also the undergrad cardiovascular and cardiothoracic conference in that was organized by King's. So as you can see, I was trying to that isn't me, but I was actually part of this chest tube insertion session. So again, I mean, we don't insert chest tube as nurses, at least at my level, but it was a good experience for me to understand what other healthcare disciplines do, for example, and also get to meet individuals from other healthcare disciplines, because there were many doctors in this conference. I think these are some of the benefits I would say throughout my experience, getting to meet people and learning from them, and not just being limited to within nursing, but also trying to find ways I can learn from other disciplines as well. And also actually in the cardiovascular conference, the one to the right, they were actually doing like a bedside echo scan on me. So I was the live patient for that scan. So yeah, so I think just learning from different disciplines was one of the benefits as well. Then, of course, just to kind of wrap up my journey at King's was eventually when I got to present my mini abstract in the SingHealth Duke-NUS Education Conference. As you can see, Sumana's also in the picture. So, yeah, so I think overall, to kind of wrap up my journey, I would say that the biggest takeaway in terms of development was getting to meet people and trying to find ways in which I can learn from them and their expertise as well. And just a bit of like a fun side of my experience was, of course, traveling around the world. So just, I mean, yeah, as you can see, I just used that opportunity to just visit different countries, just kind of immerse in their different cultures and learn to be more independent. And I think that is something that I cherish a lot in my entire experience at King's for the past over the 10-month period. And of course, cooking, because, as an international student, you are alone. So you have to figure out your way through life. So some life skills were also picked up along the way on top of whatever I learned as a nursing student. Yeah. Over to
Okay.
Sumana.
Okay, so my nursing journey in SIT, as you can see, on the left photo is just my groupmates and I. And so SIT actually has a joint degree with University of Glasgow. So on the picture on the left, we were actually together with one of our Glaswegian professors. Okay. Okay, so we used the photo, but then we also had many opportunities such as the SingHealth Duke-NUS Education Conference, and basically SingHealth gave us a lot of opportunities to advance our nursing education and just see beyond what we are learning in school. So I also went to the SingHealth Nursing and APN Conference in conjunction with the Singapore Malaysia Nursing Conference, and at SIT, I also went to different hospitals and nursing homes for clinical attachments, such as the one on the right. We went to St. John's and Margaret Nursing Home. And then I also went to SGH for one of my acute attachments. And then just a few photos of my friends and I, and just us preparing for presentation, very stressed. Okay, so as I said, it's a joint degree with University of Glasgow. So we did manage to go for exchange in Glasgow, Scotland. So these are just some photos. I think my greatest memory from this experience was really getting to meet the NHS nurses. They were so accommodating. They were extremely kind and nice. And of course, experiencing dorm life, because SIT doesn't have a dorm, right? So experiencing dorm life in University of Glasgow, it was so interesting to like live with your friends, cook with them. And then, of course, similar to Raj, I also had the opportunity of traveling across Europe. So my friends and I went to Edinburgh, London, Paris, Amsterdam. So we also became a globetrotter.
Yeah. So now we just want to spend a bit of time to just share about the Smart Mentorship Program. So it's actually a SingHealth initiative aimed at aimed at supporting nursing students and first-year RNs in their developmental journey in SingHealth. So I had the privilege of being tagged to my smart mentors in Heart Center. So Senior Staff Nurse Adlin and Senior Staff Nurse Eugene. So I was tagged to them ever since my first year of poly, till now as a first-year registered nurse as well. And the biggest benefit I would say is really getting to be more, I would say I was more mentally prepared for my postings in Heart Center, and just I was given some tips on how I can better prepare myself. And that was I think it was one of the benefits in terms of the mentorship program. And they're also there for you whenever, they're just there to lend a listening ear to you as well for your concerns throughout your, postings and your nursing journey. Yeah.
So this is my smart mentor. My smart mentor is SSN Tan Fei. So similar as Raj said, it provides like a linkage between school and work life. So I think I would say that it felt very heartwarming to know that I have a first friend from Heart Center even before I joined Heart Center. So it was actually a really, really good experience having a smart mentor with us.
Yeah.
Okay, so some of our key engagements with our mentors is learning tips on how to prepare for clinical placements. So I remember specifically there's this one instance where I was preparing for my final posting in National Heart Center, not knowing much about cardiovascular nursing. I actually asked Tan Fei for advice on what kind of pharmacological drugs or like what kind of maybe specific cardio nursing that I maybe can look up on, and she really provided me with all these insights. So I also had emotional support from Tan Fei, and also I also seek advice from her for navigating new clinical environments, also receiving inputs on my academic work in school while I was in Polytechnic.
Yeah. And just to wrap up, this will be our pretty much our last slide. Yeah. So just to share just our reflections on why we think the program is it's great in terms of supporting nursing students in their journey. So I think one of the main benefits was a sense of assurance, like what Sumana said. You know that you have someone to go to in times of need, and they are approachable. They are there to hear your concerns, and they are trying their best to find ways to support you throughout your journey. And also, these are mentors who are relatable and approachable. Again, having that friendly disposition was really good for them, because they were there to kind of check in on us and make sure that we were doing fine, and also really available in terms of allowing us to contact them in times of need or whatnot. And of course, this is one of the many reasons why we feel that SingHealth does support its student nurses and just nurses in general. But I mean, from a nursing student perspective, we did feel that support ever since year one. And that was something that, and even now as a first year RN, I'm able to keep in touch with my mentor, so that continuity of support is there ever from the time you join nursing till you transition into a first year registered nurse. I think that's one of the key benefits of the Smart Mentorship Program, and which is why I would say, do join SingHealth, not just for the open house sake, but really in terms of support. I think
Community.
we are two examples of how we feel that SingHealth does support us in terms of our growth and development as a nurse. So with that, we will wrap up, and just, coming from the council, Trailblazers, the student council, just want to quickly promote our Instagram and TikTok pages as well.
Social media pages.
Yep. So do follow us, and we're looking forward to some questions from you. Also, thank you very much for listening out. Yeah.
Thank
you.
you.
All right, thank you so much. Do follow the Instagram, by the way. Yeah, we have a lot of amazing contents. Okay. Yeah, thank you so much, Raj and Sumana. I didn't know being part of a nursing journey as a student can also involve in improving your cooking skills. Okay, so I'm pretty sure everyone has a lot of questions to ask you guys too. So let's start with another Q&A session. For the audience, please drop your comments down below. And for myself, let's start with what is one of the most memorable event you guys had as a nursing student?
Would you like to go first?
Sure.
Raj?
Okay.
Yeah. Cooking.
Yeah. So one of the memorable, being an international student, I think okay, honestly, the weather was the worst. I think that, okay, yeah, honestly, it was hard for me to cope with the very erratic weather conditions there. Okay, but that's okay, jokes aside, but to be honest, I think the biggest challenge was really trying to find a community for myself. And being a nurse, I think I was worried that I may not be able to find people who share similar experiences as me as a registered nurse. Having finished my diploma and going over to King's, but surprisingly, most of them, not really surprisingly, but more of, as nurses, our main goal is to improve patient care. And it was great that we were able to find, I was able to find friends and people within the nursing community. And I think building that community was really helpful for me to kind of learn from them as well in terms of my nursing development. Maybe Sumana, you want to share something?
My most memorable nursing experience would be going over to Glasgow, definitely, because we were given the opportunity to visit the NHS system, the UK's NHS system. So it was really a cultural shock, having come from the Singaporean healthcare system, having seen how the NHS nurses care for their patients and everything. So I think my biggest takeaway was really learning from their culture and seeing how we can integrate these experiences with the Singaporean nursing like the Singapore nursing background, and seeing how they care for their patients and improve the overall patient interaction in Singapore. Yeah.
Mm. Okay, thank you so much. Maybe let's dive deeper into the SMART program. So is the SMART program only for nursing students, or um anyone can join, or is it like what are the certain roles I have? Maybe I'm a nursing student, or maybe I'm an RN. Do I still get to join the SMART program?
So I can share this part. So the SMART program is not just for nursing students. I mean, it is for SingHealth sponsored students. So but on top of that, even first year registered nurses can continue to keep in touch with their mentors. I mean, again, at the end of the day, the program is an official program, but it doesn't mean that after the program you cannot talk to your mentors or whatnot. It's just that within the formal structure of the program, as early as your first year of being a registered nurse, first year of being a nursing student at poly, you will be tagged to a mentor within SingHealth. So it's a more experienced senior staff nurse, at least, whom you'll be tagged to. And you'll then be continuing your journey with them until you start and finish your first year of being a registered nurse. So yeah, so to answer your question, actually it's not just for nursing students, it's also for that relationship lasts until you settle down as a registered nurse in whichever SingHealth institution you're posted to. Yeah.
Okay. So it's not only for student nurses, but of course your RNs can slowly integrate into the healthcare system by
Yeah.
having a body-to-body mentor.
Yeah, that's right.
Okay. Thank you so much. In that case, I have another question for you guys. What are the um life skills you have learned for others other than cooking, as a nursing student going overseas to Glasgow, to King's College,
Maybe you want to share
London?
first? Yeah.
I would say that it's like mainly the communication skills. As I said, culturally wise, I realized that the British people are they are more they like to talk a lot
Extroverted,
more. Yeah,
very
they're more
outspoken.
extroverted and they talk a lot more and they're willing to share a lot more things. So communication wise, I realized that um I've learned to be more open about talking about like different topics, which I think it will be a good life skill to bring back to Singapore, because um like talking to patients, sometimes as nurses we don't realize how much communicating with our patients can mean a lot to them. So being able to really communicate with my patients in Singapore is a very good life skill, I would say, to have.
Actually, to tap on Sumana's point on communication, for me at least, because when I travel, for example, like for conferences or whatnot, and then most of them don't speak English sometimes, and in that case, you have to find people who can
Yeah.
speak your language. That's number one, and number two, it's being able to being confident in approaching them, right? To ask whatever you want to ask and being able to navigate that completely different culture. So I think that communication part, I think, is key. I mean, even as a nurse, you have to be willing to, voice out your concerns and even advocate for your patients. So communication becomes key. So in that situation, when I was, had no choice but to open up and ask my questions and find ways to navigate throughout my, time at King's, I think that skill was really important, apart from being independent as an international student. I think, yeah, so communication would be one of the key aspects, especially on an overseas ground where you have no other choice but to open up and talk so that people will know where you're coming from, and you'll be able to build a community for yourself. Yeah.
Yeah, I think me being as a nurse, it taught us to be a very well-rounded person other than having a skill as a nurse, right?
Yeah.
Yeah. So how about we dive deeper into we come back to Singapore, diving deeper into attachments in SingHealth hospitals. Yeah, what are your most memorable experiences, being in NHCS, other attachments, for example, KKH or IMH in a sense?
Yeah.
In SingHealth, it was okay, I feel like a lot of people will talk about the acute postings, but I will honestly say that maybe my posting in SingHealth Polyclinics was actually quite memorable, with having had like it was a very, very different environmental like it was very different in terms of nursing environments, because in the acute settings everything is very fast, everybody very stressed in the wards, but then in SingHealth Polyclinics, I really was able to, even if it's just for a short interaction with them, just to give patients a jab and stuff like that, I actually managed. I feel like I had more time to communicate with my patients, and I get to chit chat with them a lot more than compared to acute settings, and it's just a very different in terms of nursing environment. Yeah, I would say that my SingHealth Polyclinics posting was quite interesting. Yeah.
I think for me, I actually preferred my acute postings. I mean, not really preferred, it's more of because I like a more fast-paced setting. So it was a very challenging experience for me to find ways to manage my time. And I took that as a challenge. I think that was something as a nursing student, to be honest, I struggled, right? Because there are so many tasks that are listed for you to settle within your shift. And as a nursing student, it can be quite daunting because you're in a very new environment. But of course, with the support of your preceptors and supervisors, you're able to better navigate that journey. So memorable wise is really putting myself through very challenging situations where I had to really find my way through a list of tasks to accomplish within my shift. And yeah, and also again, at the end of the day, no matter how hard the journey gets, when you have people who are there to support you, your colleagues, and even your fellow nursing students throughout the journey, I think you start to feel a bit more reassured that you are supported throughout this process, and you don't feel left out as a nursing student whereby you don't really know what you're doing or how you're trying to get through this process. So I think memorable wise is really, getting through the challenges with a group of people who are there by your side.
It's very fulfilling to see smiley faces on your patients' faces as well.
Yeah.
Yeah.
All right, thank you so much. I think there's a question for you guys. Let's take a trip down memory lane, even before we are nursing students. So, what is your motivation to even choose this career pathway?
Raj, you can.
Okay. So for me, I think okay, communication is something that I think is one of my strongest points, my strengths. And being able to meet the needs of people, in their rather vulnerable state, I think that's really empowering or very powerful in that sense. It's something that not everyone will be able to do it. And when you're able to do it, you realize how much of a difference you're making in the lives of people, right? So it could be as simple as, wanting a certain type. I mean, maybe a patient voicing out a certain preference for something, or a certain need, and you want to make sure that you find ways in the best way possible for you to meet those needs. And I think being a strong communicator is great, because that allows you to then voice out their concerns on their behalf, which is what patient advocacy is all about. And then from there, after you address their needs, like what Sumana said, seeing that they are satisfied with their whole patient experience with SingHealth, I think that is something that I felt was that I wanted to kind of put to good use in that sense, put that skill to good use. Yeah. So communication, like being able to be a voice for the people. I think that's something, one of the main reasons why I chose nursing. Yeah.
So, similar to Raj, I also would want to be a voice for my patients as well. But I think for me, it was more of a sentimental value. So, I joined nursing at the start because I have family members who are also part of the healthcare system. They're not in nursing, but I realized that I wanted to be a nurse because there's a lot more patient interaction and there's a lot more patient advocacy involved. So I think something that reassured me that I was in the right course and in the right profession was when I was caring for my grandmother when she was on her deathbed. She was under palliative care, and I saw how the palliative home care nurse treated my grandmother with so much care and love, even after her death, where the palliative team came for the funeral and everything. I felt like, wow, I didn't know how much of an impact nurses can be in not just a patient's life, but the patient's family's lives. Because like, even though I wasn't my grandmother, I was directly impacted by the amount of care and love that the nurse have provided for my grandmother and her family members.
Okay, thank you so much. Okay, I think I have a question for you, there's an audience who is considering going to nursing. So if you could travel back when you are still in poly, what would you say to your younger self? Maybe some reassurance from the audience, or maybe some warning regarding being a nurse.
Reassurance. Okay, I think going back to one of the points that I said, I mean, you're not alone in this journey. I mean, we think that, once you're a nurse, you're on your own, you have to figure it out yourself. Even as a first year RN, I also have preceptors and supervisors who are guiding me through this journey. So it's not a case whereby when you are a nurse, you're on your own, right? I mean, again, nursing is about teamwork, and it's true because at the end of the day, when you go for your postings, when you are working together with people, you start to build friendships beyond, just colleagues. You are actually good friends. And that's how you kind of navigate the journey. So not to feel daunted by the fact that, you're new to being a registered nurse. I think that was one thing I was fearing throughout my, growing years as a nurse. But after all these years, I feel that the one thing that kept me through, it's the support that I got from my friends, my fellow nursing students. Because at the end of the day, your fellow nursing students, your classmates are the ones who really, share the similar experience as you, and they're there. You can relate to them, right? So that is something. So not to feel daunted by that. So yeah, just go for it. It's going to be a wild ride, but
Yeah.
just go for it. Yeah.
Say one warning, I would say nursing is not easy. It's really not an easy profession, but it's an extremely fulfilling profession to be in. And as Raj said, like the support, the friends you make, like even though Raj and I are from different polytechnics, we actually became quite good friends after we actually were ward mates during our PRCP attachment. And I've seen how Raj works, Raj saw how I work, and then we just, even though there were differences in our work ethics, we tried to support each other in our postings and throughout. Raj still helps me with my assignments now and then, that kind. So it's really the friendship you make, the people you meet, your patients, your teachers. I'm still in contact with my NEAN lecturers. Yeah.
Yeah.
I guess we could sum it up as a very thrilling roller coaster ride, full of adrenaline rush and a memorable roller coaster ride, let's to say.
Yeah.
Yeah, okay. So thank you so much to the both of you. I
Thank
think
you.
now we have heard from the motivation of being a student nurse. And then let's dive deeper into creativity and innovation aspects of nursing, where the nurses had to join hand in hand with technology and creative thinking to develop prototypes that eases the job as a nurse. So, and to improve patient safety. And it's sort of killing two birds with one stone. So up next, let's watch a short video as we begin our next segment as an innovation nurse.
Greetings! In this presentation, you will get to find out more about how we advance nursing care with the use of technology and a unique career path for nurse innovators in SingHealth. First, let's start with why the emphasis for nursing innovation and transformation. In SingHealth, we are consistently looking for ways to improve nursing care effectiveness and efficiency, enabling a more meaningful, lifelong career for our nurses. Being the consistent care provider, we also strive to improve the care experience of our patients and their families, promoting their engagement and empowerment for better health outcomes. Here is an example of how SingHealth nurses designed and implemented a key initiative for patient and family engagement. Please enjoy the short clip.
Welcome to your care journey. Upon admission, a nurse will guide you and your caregiver through the orientation process using your bedside tablet. This tablet gives you access to essential information throughout your stay, empowering you to engage actively in your recovery. Let's start with the MyCare app. This app makes it easy for you to stay on top of your care with a few simple sections. To help you feel comfortable during your stay, the first thing you'll see after being onboarded to the app is the orientation videos that explain everything you need to know during your stay in the hospital wards. Next, you'll see the Schedule tab. Here, everything you need to know about your day is organized neatly into 3 parts: activities, meals, medication. With this, you'll always know what to expect during your stay. In the Health Info tab, you'll find a summary of your key medical details, vital signs like blood pressure and heart rate, test results, therapy instructions, dietary restrictions and allergies, your medication list. Having this information helps you and your family stay informed and involved in your care. Need assistance? The Request tab lets you reach out for help anytime. Simply tap on the service you need and the nurse will be there to assist you. Good communication is key to good care. With the Care Team tab, you can send messages to your care team and receive notifications from them. It's as easy as using a messaging app. The Profile tab allows you to view your personal information and next of kin's contact details, as well as manage your app password. From here, you can also access the MyEdu app for educational resources. We believe that recovery should be engaging. That's why the bedside tablet includes games that promote mental activity and physical rehabilitation. You can also use the Food In and Out app to track your meals, drinks, and other important details, like daily fluid intake. With guidance from our nurses, you or your caregiver can log what you eat and drink, and even track outputs like vomit or pass motion. All of this information helps your care team monitor your progress and keep you on the right track. The My Symptoms app, designed to empower patients and caregivers to report symptoms and observations, either for themselves or on behalf of loved ones. By tracking real-time changes like pain, fatigue, appetite, mood, or behavior, you help your care team adjust treatments and medications quickly for better care. As you prepare for discharge, MyEdu app will provide all the information you need for your ongoing care at home. In addition to access to the hospital orientation videos, you can also view materials assigned by your healthcare team, save your favorite resources for quick access, explore a library of helpful content to support your recovery, as well as can even email the education materials and discharge brochures to yourself or a family member to prepare for care at home. With these bedside tablets, we empower patients and caregivers to stay informed, engaged, and connected every step of the way. Together, we can achieve better care outcomes and ensure a smoother recovery journey. Thank you for your attention. This video was brought to you by SingHealth Group Nursing.
Thank you for watching. It's initiatives like these that showcase the dedication of our nurses to innovation and patient-centered care. Now, let's shift our focus to another crucial aspect of our work: improving the effectiveness and efficiency of nursing care. In terms of improving nursing care effectiveness and efficiency, here are some examples. During the pandemic, we rolled out remote monitoring and telecommunication to reduce our nurses' risk of exposure and also reduce the time it takes for them to care for individual patients. Our nurses now also enjoy the use of corporate iPhones while at work. With just a few clicks, nurses are able to obtain wound images, and the application will automate the calculation of wound size and indication of tissue types as well. With the iPhones, SingHealth nurses can also now text one another with ease and obtain alerts when patients require urgent attention. Other than iPhones, we have also adopted many other technologies to help our nurses during work. such as an automated sit and shower chair and auto-tracking real-time tracking of equipment. We are also harnessing the power of AI. As part of efforts to improve nursing care, we have developed and researched on assessment tools. Moving forward, we are now developing AI models to help our nurses in the conduct of risk assessment and supporting them in everyday clinical decision-making. Other than patient care, we are also harnessing the power of AI in our nursing training and education, as shown in this example here. All of the above examples were made possible by nurses who wanted to improve things for their own teammates and patients. In SingHealth, we offer a career path for nurses who are keen on pursuing innovation as a focus. For nurses who are keen on the innovation track, training will be provided to support them throughout their careers, from short courses when they are still starting out, to formal courses and fellowships as they gain more experience and expertise. I hope this presentation has given you an overview of nursing innovation and how you can also make a difference when you join SingHealth Nursing. Thank you.
Alright, hope you guys have enjoyed the video. And if you guys have noticed, the video is completely done and narrated by AI. Yeah, I think AI nowadays, it will definitely help with my stage fright. Okay, so now I'm pretty sure you guys are more curious about the people behind nursing innovation. So let's welcome Senior Staff Nurse Jason Mock from National Eye Centre to share with us more on his journey and his experience as a nursing innovator. SSN Jason, please.
Hi everyone, I'm Jason. I'll be sharing my slides on Nurse Innovator. Okay. Just to introduce myself, I'm Jason from Singapore National Eye Centre, which is one of the institutions from SingHealth as well. Okay, just to share some of the interesting things as a nurse innovator. So things I'll be covering for this slide. Okay, so what is a nurse innovator? So innovation is something up and coming. I believe it's a common term right now in Singapore. You can hear it commonly used in a public area. Okay, and how it links to a nursing role. Okay, what is our focus and what do we do pertaining to this area? And of course, I'm going to show you some examples. Some are completed and some are ongoing, so that you can get an idea of what we do in this clinical area as a nurse innovator. Okay, I believe this is shared multiple times. So out of the 6 tracks, innovation is one of the tracks. So I'll be focusing on the innovation part. Okay, but before we explain a bit about innovation, I want to share a bit about my nursing journey. So you get a link between my experiences and the projects that I'll be sharing with you. So I started off as an enrolled nurse. I believe some of you do know that enrolled nurse started off with certificate with NITEC in nursing from ITE. So that took me about, I was in this role about close to 11 years. So 11 years after that, I moved on to be a staff nurse and take up a diploma in nursing course and stayed on up to now for about 5 years. And during this part, throughout the journey, at around this stage, then I decided to take up this nursing innovation role to be a nurse innovator. Okay, so in my perspective, a nurse innovator requires a few characteristics. First, you must have ability to ideate, means you must be curious on how things work and to think out the box, because in order to ideate, you have to think not how the traditional way think. You can think about multiple possibilities of a solution that you want to implement for the patient or sometimes even to staff. Okay, you also need to understand the needs of the patient, family members or public, and this you need the experience which I shared before with my close to 15 years experience, and the specialty training which was shared earlier on that most nurses do take up after a few years in the clinical area. So personally, my specialty area is focusing on peri anesthesia, which is what you see in operating theaters when the doctor covers your face with a mask to make you sleep. That is the area that I'm focusing on as my specialty. Okay, so to break down, what is a nurse innovator? Okay, one who manages patients' care and perform clinical procedures. Okay, procedures such as maybe wound care, maybe injections, or even serving for medication. Okay, the nurse also provides education and training to patients, public, and their family members. As you have heard from our previous speakers, we not only care for patients in the hospital, we also care about the public and their family members. Okay, linking to innovation, what we do as an innovator is to develop ideas for improvement or to solve problems and to link both together. Okay, we develop and create solutions to enhance nursing care, mainly in the processes to increase efficiency, to help our patients in the hospital, and of course, to reduce manpower load. As you know that with the rising load of elderly population, we do want to see we can optimize our processes to reduce manpower load to serve more patients. Okay, so some examples of the projects that are either completed or ongoing. Okay, first I will share about a video, which is to reduce preoperative anxiety for my pediatric patients. Pediatrics are a group of patients who are younger, like children. When they come in for operations, they do feel anxious. So this is the project to address that issue. We do have projects that are pertaining towards 3D modeling and printing. This is specific to the role that I'm taking up in the surgical suite, mainly in eye operations, to facilitate accurate monitoring of patients under sedation. Okay, we do have a project that is ongoing right now to facilitate preoperative or pre-surgery medication advice for diabetic patients. Okay, and of course, not everything is mainly to clinical areas, which is the what you see in the patient in the ward. We also have projects that are more fun to facilitate training for our new scrub nurses. Scrub nurses are nurses that assist the surgeon during the operations. So we need to make sure that their trainings all this acute and stressful, but it can be find a way for them to pick up this new skill in a short span of time. Okay, so first, the pediatric video that this is already completed. Just a bit of context, like I said before, patients who come inside for operations do feel anxious. And furthermore, for pediatric population, which is the children, they'll feel more anxious. Most of the time, the reason is because operating theatre is a foreign environment and they are not used to the people wearing a different suit with their mouths covered and only can see their eyes. So this video let them feel a sense of control. So they do know that, okay, this is what they're going to expect and everything is under control and they just need to follow the instructions. This video tells them that everything is safe and also serve as a form of education material so that even the caregivers do know what to do when they're in the operating theatre. So as you can see from the picture, the patients, when they come inside, they will need to lie on the bed. Everything is safe. They don't need to worry. The parent will be there throughout the process, after which, okay, the mask will be put on the face. Nothing will be harmful will be placed on the face. They just need to breathe the gas and follow doctor's instructions. After that, the video then shows that at the recovery area, which is after the surgery, their parent will be there so that when they wake up, everything will be in a controlled environment with no pain and their comfort will be reassured. Okay, next will be an ongoing project, which is a 3D related and printing project. Just a bit of context again. Okay, what we are trying to improve is the current material that we use to monitor sedation for patients during surgery. So one of the main concerns for this monitoring is that we do need to know that if the patient is breathing well during the surgery with the drugs that is administered. Okay, so when we breathe, our lungs expand, and what we exhale is CO2. So as you can see from the top right-hand corner, you can see that there is a wave that is commonly shown on the monitoring scale. We want to monitor this scale. Okay, so when patients are anxious before surgery, for eye surgeries such as cataract, we do give them medication. So the anesthetist will give them a medication to make them relax. However, this medication, other than relaxing their mind, their body has a certain effects as well. So one of the main things is their breathing. Some of them do have a muscle relax, which affects their breath, which affects their tongue, which then affects their oxygen level in the blood. Therefore, monitoring is crucial. So what we want to do is that to create something specific to the needs of this group of patients, of this group of staff. So just an example, we ideate means that we find a solution that is out of the box. In order to show people a solution that's out of the box, we do need skills and capabilities to design something such as the 3D modeling. After that, once this is shown with the feasibility, we then produce it with prototyping, which is what you can see on the right side. You can see that it's printed using 3D material, tried on healthy individuals, and if it's feasible, then tested on patients. Okay, as you can see that, okay, although we do not train 3D printing or modeling as our primary skills, we do have facilities and resources to help us in this. What we need to do as nurse innovators are to know what are the real problems that is faced by patients and the staff, so that we can relate this to the people or the resources that we can use on to help serve this group of people. Okay, next will be creating a simple app. Okay, like I said before, we are not primarily trained in creating an app, creating a 3D modeling, but we do acquire simple skills so that we can serve the specific needs of these group of patients, so that we can then help the people. Okay, so I'm going to show you a video on how an app is created by me. Okay, so although you do not know coding, I am also not very good at it, but you still can acquire this simple skill as a nurse innovator. Okay, what I'm trying to create is to link different screens based on the buttons that will be tapped on. Later, I will show you an example. On whenever you tap a screen, instruction will be appearing to facilitate a pre-anesthesia or pre-operative assessment for patients before their surgery. Okay, so I'm just rearranging some buttons and renaming them. Okay, then after renaming them, I'll then arrange a basic code behind, so that the application knows what I want to do after you press the button. Okay, so just to show you how the app works on the front side. Okay, whenever the nurse or the patient press the button, instructions will appear. This will then facilitate the pre-operative advice to the patients, so that we can serve more patients that are specific to these needs. Okay, so next is a serious game, like I said before. Not all applications are served towards the clinical needs. This is specific for staff training. I will show you an example as well on how staff can be trained in a critical area in a fun way. Okay, so just to recap again, with all the examples, nurse innovator is basically what a nurse do using innovation to improve patient care. And we want to enhance nursing care and solve nursing problems by innovating with new ideas that are out of the box and not in the market. Okay, we are placed in a unique position to find the most appropriate solution for our patients and, of course, staff. Okay, that's all for me. Thank you.
Okay, thank you so much. Wow, I think it further highlights the well-roundedness we nurses have, other than cooking, teamwork, communication. Now we have coding and furthermore innovation and creativity. So thank you so much. And again, it's Q&A time. So draw your questions down below and don't be shy and ask away. So for me, I have my first question over here is why do you decide to be an innovation nurse?
Okay, since young, I like to tinker with things and find solutions that are not typically in the market. Therefore, I pursue this role or this track because I like to create things that are specific to the needs of whoever that is have issues or problems with in the area.
Ah, a lot of if the market doesn't have, I will be the market instead, that kind of vibes. Yeah. Okay. So what is the most challenging portion, in balancing the innovation portion of a nurse and the clinical portion?
I would say that finding the actual problem, although you do have the experience and specialty training that is acquired, sometimes your perspective may not be the real problem of what the population is facing. So you do need to have a lot of communications with the major stakeholders and to get buy-ins and to know that okay, this is a real problem before we can convince another group of people that we can pursue this project before we start.
A lot of managing stakeholders, a lot of inventing new stuff, and it involves a lot of technology. Then does it involve like, do I need to have a background in IT to be an innovation nurse, or can I come step into the world of innovation as a fresh grad nursing, not doing anything except just nursing skills?
Actually, as long as you have because you do not have all the answers regardless of the years of experience and the training that you have. Like the example that I showed you, especially the coding one, it was based on an elective that I took in poly. After that, I went on to further expand the skills using YouTube videos, in fact. Then taking into the problems that I had and using this possible solution tool. Yeah, so you don't really need an IT background. Yeah, you just need to have the ability to think out the box to find a solution to the problem.
Uh, a lot of I think it grounds more on your vision that you have as a nurse. Yeah. So in that sense, what are the criteria of becoming a innovation nurse in a sense? Like what do I have to have? Like is it a lot of curiosity? Is it a lot of communication in a sense?
Um, yes, exactly. Whatever you have just shared. Yes, creativity and communication. But of course, one of the main thing is to find the real problem because you may think that finding problem is easy because everyone do have issues. Um, but you do know that okay, once you enter the line, nurses are very adaptable. But we in order to find a problem after we are adapted, it's hard. So our role as a nurse innovator is to stand at a macro view and to see that this problem is persisting. And although nurses are adapting to this problem, we can find a solution to aid in their daily processes to help patients.
Okay. And in that case, if you can change or invent something in nursing, then what would it be?
Something that has been in the back of my mind for a while is that I want to have something that we can help patients who are at risk for falls, but I don't want the nurse to be holding the patient because we do have to take care of a number of patients per nurse, and every time, as you can understand, whenever a patient needs to walk to maybe to get a drink or to go to a toilet, you do need someone to hold the patient, right? So if there is something that suspends the patient and to prevent them from falling, that'll be the best, especially
Yeah.
in our clinical needs right now.
Yeah, there's a lot increasing unfortunate amount of numbers in falls, unfortunate events, patient having sudden weakness, and if there's like a machine or something that can help us catch them when they're falling down, and it's something that's easily attachable, yeah, I think that is something that we can touch upon too in nursing. Yeah. Then in that sense, since you have like um a vast experience in innovation as a nurse. So what is the most enjoyable portion of the job?
I would say that after you have completed the intervention, you see that it works. It truly works to what you identify as a problem, and your solution address that problem. Yeah, and the problem is specific to the needs that you have created, because sometimes along the way throughout the process, you do deviate, and that deviation is not far away from the main aim.
Okay. So no, thank you so much. It's very creative and it's a lot of out of the box question and the part of the job where I think there's a lot of excitement in going to work every day. Yeah, a lot of light bulb moments in this job. Okay, so thank you so much, Jason, for this interesting sharing session. So up next, we have operating theatre. Wow, the very restricted door. Every time you go into the hospital, then there is two big doors over there that's restricted for staff only. Ever wonder what goes beyond that door? So it is an operating theatre where a place where precision, teamwork, and quick thinking comes together to make a real difference in patient lives. So before we invite our speaker to share more about her journey, let us watch a short video to give us a behind-the-scenes look on what is it like to work in a dynamic environment, working with instruments and machine in a very fast-paced environment.
Every day starts early. As an OR nurse, timing is everything. We need to set up the theatre before the first surgery begins. It is important to wear the proper attire. Stability and professionalism go hand in hand. Once I'm in my scrubs, it's time to get to work. Welcome to the Singapore General Hospital Major Operating Theatre. I'm Senior Staff Nurse Russell and I'm your guide for today. Come, follow me. The OR list is our roadmap for the day. It outlines the day's surgeries, surgeons, anesthetists, and even the patients we'll care for. I check for any gaps, missing instruments, special needs, or even staff shortfalls. Instrument readiness is non-negotiable. If anything is missing, I coordinate with the sterile supply unit immediately to ensure we are fully stocked. It is a team effort. The SSU ensures all instruments are sterile and ready for use. I ensure that the right patient receives the right instrument. In the OR, stability is paramount. We only use sterile instruments from the cleanest hands. As we count the instruments, we also make sure they're all intact and fit for patient use and optimized. Now that we have done our counts, let's get to the operation. During surgery, my role is to anticipate needs and maintain sterility. Timeout is a pause for safety. Everyone in the room confirms the surgical plan. It's a moment of unity before the surgery begins. During surgery, my role is to anticipate needs and maintain sterility. It is a dynamic environment that demands precision, focus, and quick thinking. Monitors for you, Remember, take deep breaths, okay? sir, take deep breath, okay? We're gonna give you some oxygen now. The handover is critical. It ensures that the recovery team knows everything about the patient's condition and surgery. Communication here is key to continuity of care. The day ends as it began, preparing for the next. I document every detail and ensure that the OR is ready for tomorrow. It is exhausting, but knowing that I have made a difference makes it all worthwhile. While every day is a challenge, it is also a privilege. Being an OR nurse means being a part of something bigger.
Wow, that's a really insightful video. Bringing us around SGH Major Operating Theatre and the arts behind the big blue gown. Yeah, so now let us invite Sister Tan Hui Feng, Senior Nurse Manager of Major Operating Theatre SGH, to answer all our burning questions and curious questions about working in the OT. As usual, put your questions down below. So, hi, Sister. So, would you like to introduce yourself?
Hello, everyone. Hi. Thank you. Just want to say a warm welcome to the SingHealth Nursing Virtual Open House. I'm Hui Fen once again from SGH Major Operating Theatre. Okay, it is really an absolute pleasure to see so many of you still with us online on this beautiful Saturday morning. Thank you for taking the time to join us in exploring the incredible world of nursing in SingHealth. Please feel free to shoot me any burning question that you have. I will try to answer as much as possible. So maybe a brief introduction about myself. Okay, so for me, since young, I have always been wanting a job that can enables me to do something that is meaningful and fulfilling. So somehow, trying to small on this, like drama in the TV series, then I realized that hey, nursing is very interesting, and I know that with nursing, I can do something meaningful and fulfilling. So a nurse it shall be. So I joined after my O levels. I joined NYP to start embarking in my journey as a student nursing. Then I was given the opportunity to attach to various hospitals in SGH because I was not a sponsored student. So I get to choose where I want to go. That was the days. So anyway, deep down somehow, when I went to SingHealth, okay, I realized that in SingHealth, I really love the challenging and the fast pace and the supportive nurses that I've met, and of course the multidisciplinary services in place. And I feel that as such, it will actually help me in my professional growth. So somehow I chose SGH, I chose SingHealth, and here I am. So you must be wondering, hey, how come I chose OT nursing? So during my student days, I went for my attachment and all that. We get to be rotated to different specialties. So one of the specialty in nursing that really sparks my interest, like what Ethan have shared earlier, is the operating theatre, so-called the forbidden city, because the two doors, right? Every time you see restricted, it got me really curious, you see. I always really wonder, especially during my student days. I send patient down for surgery. Then I was like, there's two doors, you see. So I always want to peep. Then I realized that, every time the door open, I'll see like, it's always bustling with life, like the angels in scrub suit moving around, that kind of thing. Then it really got me wondering, like, what really awaits behind this door? Like, it should be really fascinating and exciting, like a magical kingdom. You send patient down for surgery, right? Somehow they got fixed, Then when you see them at the ward level, they feel this later, they are well, they are recovered, which you find interesting. I mean, for me, I find it really interesting. So I always thought it, like OT, besides being the forbidden city, it's like the magical kingdom. And so after I graduate, the year 2005, oops, I think you all can guess my age. So it marks the start of my dream job in SGH in Major Operating Theatre. So maybe a brief introduction of the SGH OT itself. I do have 26 OTs in SGH, Major OT. So there's different specialty sub-discipline as well, which include like general surgery, colorectal, obstetric and gynae, plastic and reconstruction, then orthopedic, ear, nose, throat, dental, urology, pediatric, anesthesia, recovery room, blah, 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 blah. And of course, my sterile supply unit that, just now you saw in the video, right? you all saw the instruments and all that. So yeah, there's many specialty, many department. And of course, we also cover like cater to the elective, both elective and emergency surgery as well. And we run 24/7 basically. So in the OT itself, as you can see from the video, we do have many different roles, all the way from pre-operative to intraoperative to post-operative. So maybe a brief summary about myself. I'm attached to the intraoperative, which is the surgery side, meaning I assist the surgeon and feel the adrenaline rushing during surgery. So I'm in charge of general surgery, basically. You must be wondering, what is general surgery? Very generic, right? It is generic because basically I cover head to toe. So from the head to the toe, meaning I cover, like thyroidectomy, I do abdominal surgery, I do lung surgery, and of course, I also cover obstetric and gynae as well. I do delivery of babies. So one thing about me is I was given a lot of opportunity by SGH, by SingHealth, and I'm also specializing in abdominal transplant, which means I know liver transplant, I know kidney transplant, uterus transplant, and of course, robotic surgery. And on top of that, we also collaborate with my SingHealth, fellow SingHealth institution, like KK Hospital. We also cover intestinal transplant surgery. And with that, this year actually marked my 20th year in SGH. Oops, now you all know my age. So why SGH and why SingHealth? I would say really during my years of nursing in SGH, right? Like what, Rajesh and, Sumana have shared earlier, you see, I'm really very grateful for SingHealth in the sense that I was actually supported with numerous opportunities to really support my nursing profession. Like, for example, I got my scholarship for my advanced diploma in, specializing in perioperative nursing at NYP. Then a few years later, I also got, the scholarship for the degree with SIM under University of Sydney. Then thereafter, with my interest in more complex and, transplant surgery, I was also given the opportunity to go for the Health Manpower Development Plan, which is what we call the HMDP sponsorship, to embark in overseas training, specializing in abdominal transplant surgery in US for 6 weeks. It was really an eye-opener. Yeah. Then thereafter, when I come back, I was also quite active in like research, QI projects, to enhance the work processes in place. So somehow I also given a lot of opportunity to showcase them my project in both local conferences and overseas. So some of them like that I went is like, the ASEAN Network for Quality Congress in Bangkok. I also went for the American Operating Room Nursing Conference in US as well. Then to keep ourselves abreast in like, all the new technology and devices in the OT, got to keep up with all the surgical techniques, you see, and advancement. I was also sent to Japan just last year for a usability test with my chairman division of surgery to try out new the Japanese robotic surgery system. And now we actually have acquired one in SGH OT. Not only Da Vinci, we also have this Japanese robot called the Hinotori. And of course, now also embarking on my scholarship, pursuing my master's in nursing as well, which is due to complete this year. So I am really, really quite grateful and appreciative of how much opportunity SingHealth actually offer me to travel around, to explore and enhance my nursing career. Yeah.
Wow, thank you so much. A lot of comment sharing here, a lot of overseas experiences that SingHealth offers, conferences to Bangkok, to Japan, and then for Rajesh and Sumana to London, to Glasgow. Yeah, and then I've heard that you've mentioned about technologies. Can you maybe share like a brief the generational growth of technology over the years since you have been in OT for so long? Yeah.
Yeah, so that's a very good question. You can really see the evolution of the surgery, how it transit itself, back in I cannot say olden days, I'm very old. So back during my junior years in OT nursing, most of the procedure was actually performed in open surgery method. So you all know open surgery method means more traumatic for the patient. Hence, the recovery period also took longer. As it advances, technology advances and surgical technique advance, we move on to minimally invasive. Okay, so-called partial minimally invasive, like with small pots looking at the TV with long laparoscopic instruments. Then, of course, we still play cheat a bit, we still have a little open wound. And now we're moving towards NYS, which is full laparoscopic surgery, and of course, leveraging like what Ethan has shared, leveraging on technology like the robotic. We actually have surgeons who do minimally invasive surgery using the robot, which means how they do robot surgery is, of course, they will have an assistant to help, guide the robotic arms into the patient's abdominal, to these special pods, to guide instruments. And the surgeon, of course, they are like, on the other end of the OT, sitting down with a console, like playing video games, not video games, with 3D images. Yeah.
Okay, thank you so much. We have a question for you actually. So thank you for sharing. I have a question regarding what it takes or to qualify to become an OT nurse. And I've heard that you have several experience of ward nursing. You need several experience of ward nursing experience, and it's quite difficult to get to OT. So what do you think about that?
I wouldn't say it's quite difficult to get into OT. I'm sure if let's say you have interest in OT, sure, by all means, but of course you need to have some basic as well in the ward. At least you need to know, before patient coming to the OT before surgery, what are the basic preparation, what are the basic care, and of course the post care as well, before coming to OT, to gain some experience before coming to OT, to be a OT nurse. And when you come to the OT nurse, you must be wondering, hey, what criteria I need? Do I need to be this, or that? Okay, I will answer your question here. First thing, of course, you need to be curious. And as you know, in nursing, we are patients advocate. So likewise, in OT nursing as well, we are also patients advocate. So please feel free to speak up. Be curious, not afraid to speak up. And of course, you need to have some critical thinking. I mean, although the SOP, the standard of practices, is pretty standard during surgery as well, the steps and all that. But of course, sometimes, different patient, it varies. We may have an unanticipated situation. Okay, so you need to have critical thinking to think, hey, this thing happened. So what should I do next? We should always have plan B. So that's why critical thinking also come in place. So with these three, I'm sure there's no issue, because if you're going to join us in OT as well, no worries, because we will have established a 3-month orientation program with on-the-job training, with theory training. You'll be fine, and you'll be tagged along with your mentor, your preceptor, who will be always on site with you to buddy you, to support you throughout your career in OT nursing.
Yeah, there's a very generalized support system here in SingHealth where you are supported with buddy-to-buddy system. Yeah. And then there's another question for you. Approximately how many OT nurses are there? And do you work with various surgeons from different disciplines, or do you usually work under the wing of a specific surgeon? And could you give a bit of sneak peek of the new robot too?
Okay. So if you're gonna say that, yeah, we do have a lot of nurses. Easily like 400, about approximately 400 nurses. So if with regards to the working with specific surgeon, no, we do rotate around. Like I mentioned, we got different specialty, you see. So probably when you started off, you'll be attached to one area first. Then in time to come, if let's say you have the interest to, enhance your skill and knowledge in another OT area, sure, we will actually rotate you around. So we are all rounder. We don't specifically just work for one surgeon or one particular specialty. And of course, for robotic surgery, definitely not any junior nurses can just simply, hey, I want to join the robotic OT, I will be there. I mean, it takes some time. You need to build up the foundation and your basic first. With that, we'll easily be able to train you in the robotic thing.
A lot of I guess to say have a lot more getting more experience in a sense.
Yes.
And learning different equipment as time goes. Yeah. And then maybe talking about the intraoperative, maybe we could go to more of the SSU department if you could explain more.
Okay, you all must be wondering about the sterile supply unit, right? When you all saw, how come, there's this the leaf thingy, this mini leaf that the instrument go up and down. Okay, that's what we call the dumb waiter, as per se. So basically, what happens, you saw in the video just now, every morning, after checking, the day before we actually order the instrument, but sometimes we may have some shortfall, okay? Because like I said, we run 24/7. Like the emergency OT, we run 24/7, you see. So whenever there's some instruments that are short for, so my staff will actually, order the instruments, then after that, it will be delivered. So you saw my SSU staff, upon receiving, the order of the shortfall of the instruments, then they'll pick up all the necessary, then they'll deliver up to us. So SSU don't just, deliver sets and all that. We do have RNs there as well. So what they did is they play a very pivotal role in ensuring proper decontamination, cleaning of our instruments, and checking, inspection, careful micro inspection. I do have, like microscope, magnifying glass at the SSU unit to inspect all the instruments to ensure the integrity of every single instrument that was used in patient in the OT. And of course, you do go through the packing and sterilization and ensure the packaging, everything is in place before delivering to OT for use for patient in surgery.
Wow, okay. Wow, that's a very diverse role that we have here in OT lah. So
Yes.
what other responsibility does an OT nurse have? And do they have any other chance to be rotated, in a sense?
Rotated in the sense of rotating to like different subspecialty. Yes, like I mentioned earlier, definitely there will be opportunity for them. So they can start off in one particular specialty and they feel that, hey, I want to enhance myself more in certain other areas, then they can actually be rotated to another specialty to enhance themselves. So we are all-rounder.
Wow, that's very interesting to know. Maybe you can share like one unique experience that you have in your 20 years of experience.
Okay, if you want to talk about unique experience, like I say, I'm specializing in transplant, maybe I can share about the first time I went for the organ procurement in Changi prison. Just to share, we actually do go to Changi prison to procure the kidney organ. So it was an eye-opening experience because not every one of us get the opportunity to enter Changi prison. I mean, nobody will want to do that unnecessarily. But yeah, I was very glad I was given the opportunity to go to the Changi prison to procure the kidney organ. It was quite an experience for me because you need to go through like identity checks and all that. And yeah, but at the end of the day, I think it's really very fulfilling for me because being able, I would say probably the end is the beginning, you see. So the end of a life, it actually brings his or her organ, actually brings life to a few other people. So it's really the life of hope and joy. So hence, I would say procuring of an organ and saving others people's life is really an experience that you need to experience yourself.
Yeah, I often saw this kind of scenes, in Grey's Anatomy, in uh a lot of this kind of medical shows, and I'm so very curious about this kind of thing. Yeah. In that sense, it's a very I find it's a very well-rounded job as an OT nurse, and you get to discover a lot of restricted experiences that we do not get as like members of the public. Yeah, and it's very interesting to share about also. Yeah, so thank you so much, and thank you so much for sharing, Sister Tan. And if you guys have any more questions, do drop it down in the comments below. Do drop them down in the chat below. Yeah, if not, then I guess that's a wrap for everyone. Thank you so much, Sister. And thank you so much for spending your time with us at SingHealth Nursing Virtual Open House. And we hope that you've gained some valuable insights and feeling inspired about what a career in nursing could look like in SingHealth. And if one thing that we want you to take away in this sharing session is that nursing isn't just a job, but a journey where you grow, make an impact, and truly change lives. And here at SingHealth, we are all about supporting every step of the way. And of course, this is not the end, but a start to many outreach activities. And SingHealth will be having more activities and visiting schools, NP, NYP, SIT, NUS. And if you see us around, do drop by our booth to say hi. And before we go, do not forget to scan this QR code that's going to appear, yes, over here. That's going to appear over here. And also do follow our socials to gain more insights to what SingHealth does offer and a lot of exciting videos and contents that we have for you to indulge after your work, or during your break time when you have a good laugh. Yeah. So do scan this QR code to let us know what you enjoyed for today's open house and what would you like to see in the future. And to reach out if you have any other questions. And do follow our socials also. And if you're interested in get a hands-on experience, do sign up for our SingHealth internship program, which is at the top here, yes, over here, the mail button. Yeah. And whether you're about to join us in the next steps or just to chat more about nursing, we are here for you. Thank you again for being part of today's session, and we hope that you'll see you in the SingHealth Nursing family soon. Take care, stay safe, and keep dreaming big. Bye-bye. And transition. Oh.